So what we're going to be doing here today is a technique called a trigger point therapy. And what that's going to be doing is we're going to be actually working on the soft tissue. First, we're going to move the patient's hair. And what I'm going to be doing, I'm literally coming around and I'm feeling down through the neck, going to the base of the neck where the neck actually meets the thoracic spine. And right through here, I'm finding the areas that are very tight and where you can really feel that muscle knot. And I like to push and hold. Every time when I find that area, I like to push and hold for about 5 seconds at a time. And I'm not gonna lie, this is not the most comfortable thing done at all.
No.
How does that feel?
A little painful, I'll be honest.
Okay.
But I feel like I need it.
So this is one of those things where it's kind of like pain is pleasure with this, because as I'm coming in and pushing in, I mean, you can really see, and she's kind of holding in a little bit of the facial expression of what's going on. And I'm literally, patient has so much hair here. I literally am making my way down her back, and I really try to get underneath her scapula, with her shoulder blades is what people tend to call it. So what I'll do is I'll get right under there and I will push and hold, and I'll dig my thumb in there and I hold for, as I said, about 5 seconds. And I go through and I do that on each side. Literally 1, 2, 3, 4, 5. And I relax. Come through and get this nice adjustment in. Good. Good. And we'll go right to the thoracic spine here. So what I'm going to have you do, take a deep breath in and blow it all the way out.
Ooh.
One more time, deep breath in, blow it all the way out. Perfect.
Oh my gosh. Oh.
As a thrust. There we go. Do you notice how her entire hips and pelvis is all rotated to the left like that? Correct? So we're all rotated like this. So what I'm going to focus on, we want to get, instead of that high hip here, we want to bring that down. We want to level everything out here. Start off always right at the T1. If you come on in, you'll probably hear this move quite a bit.
Holy moly.
Good. 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 Perfect. So we're going to bend that top leg. Yep. Keep that bottom leg straight. I'm going to roll you over. Good. Okay. Laterally flex. Rotate. Good. One more time. Laterally flex. Rotate. Good. Together. Good, good.
Woo.
There we go.
I felt that all the way down to my butt.
Good. Good.
Oh.
Good. Elbows together. Long for me. Yeah. Perfect. Alrighty right there. Jeez, that moved a lot. Good. Sorry. Good. Perfect. Lay flat on your back. Good. tell you're feeling that. And you're feeling a lot of movement with that, aren't you? Maxillary sinus. Good. Perfect. Okay. There we go. Good. And we're here. Perfect.
Cool.
Perfect. Good. Side. Good. Hands over mine. Lean back. Elbows together. Good. Perfect. And exhale out.
Oh.
Okay, come on. Close together. And we'll do leg pull on the left, leg pull on the right. And I can tell she felt that move there.
Oh, I did.
Okay, same thing here. Good. And just a nice pull here.
That felt so good.
Same thing. Good. On the table, we're now actually lifting up. So with this, same thing there. So this is going to be pulling on the cuneiforms right through here. And I'm going to do this both bilaterally on each leg. There
Nice.
we go. Wow, that one moved quite a bit.
Yeah, it did.
Everyone has 3 arches we need to worry about. We have that medial longitudinal arch, we have the lateral longitudinal arch, and we have that transverse. So what I'm going to be doing right now is I'm just going to be opening up those metatarsals right in the middle here so we can work on that transverse arch. So there isn't really any thrusting with this adjustment. It's more of a kind of just putting motion into the joints here. So we're going to do that on both feet. We're going to get that motion into the joints. This, like I'm saying, you know, it's just opening up those metatarsal heads and just getting a little bit more movement in that area. So you want to take the foot. There we go. And that line of drive, I'm just dropping that navicular back into place here. We're going to do the same thing on the other side. Good. You can go through. You can adjust, you know, all the phalanges, all the toes here. Good.